Gastroesophageal reflux disease is very common. Perhaps 10 to 20% of patients in the Western world will suffer regular symptoms caused by reflux of acid. There are a myriad of different symptoms. Typically, patients will experience upper abdominal discomfort, regurgitation of acid causing heartburn, burning behind the breastbone, sometimes even regurgitation of acid up into the mouth, into the nose. These symptoms are often worse at night, and patients sometimes wake up at night with acid in their throat and therefore find some relief in propping up the head of the bed. Some patients can, in addition, suffer slightly less typical symptoms, called either respiratory type symptoms with a cough, asthma, even sometimes chronic lung disease, which can go unrecognised for a long time. And some other patients will present with symptoms which are thought to be caused by ENT type problems. So sore throat, change in their voice, sore tongue, sore throat, pains in the neck, and even sometimes pains in the ear. At the worst end of the spectrum, some patients can experience bleeding, can get narrowing in the esophagus, and reflux is thought to be one of the major causes of esophageal cancer, which again is increasing rapidly in its incidence in the Western world.
I first started noticing the problem when I went up to London, had a pH test, and it come back that the muscles just weren't working at all. I started getting sort of problems around when I was about 21, sort of mild acid indigestion, and it sort of got quite sort of worse really. And I was getting sort of pins and needles in the face and the arms, and quite sort of chest pains as well, and that sort of thing. My symptoms got worse over the years. I mean, it didn't matter what I took in the end, and the PPIs or the Gaviscon just didn't work at all.
The treatment of reflux is aimed at the symptoms. There is a spectrum of severity, with some patients just experiencing perhaps a bit of heartburn if they eat a curry or drink too much beer late at night. And obviously in those kind of cases, one advises patients to adopt lifestyle measures to remove the cause of their symptoms. Many patients find that whatever they do, their symptoms persist, and therefore they seek advice from their GP. Investigations are usually unnecessary, and particularly in younger patients, they can be treated with antacid medications aimed at reducing the acid levels and the symptoms that it causes. Indeed, the use of antacid medications is very common. Indeed, antacid medications used to treat reflux is one of the most common prescriptions, accounting for 10 to 15% of all prescriptions issued by general practitioners in the United Kingdom. There are, however, a significant group of patients who either find that pills simply are insufficient to control the symptoms, which continue to affect their quality of life, or alternatively, the antacids, particularly the so-called PPIs or proton pump inhibitors, can cause side effects which some patients find intolerable. And furthermore, there are some patients who simply do not like the idea of taking drugs for the rest of their lives.
Well, originally I was just taking sort of Gaviscon anti-reflux stuff for it, but it just didn't seem to get any better. And even the PPIs weren't working after a while. And obviously the only other method is surgery, which didn't appeal to me at all really, because I've heard there's a lot of failures, in that sort of thing, so it didn't appeal to me at all really.
This so-called Linx procedure, again, is a minimally invasive operation performed as a day case through little tiny incisions in the abdomen, through which a camera and instruments are placed whilst the surgeon watches what he's doing on the television. The operation itself involves placing a ring of magnetic titanium beads around the bottom of the esophagus, and this acts as a new valve. The magnetism in the beads is sufficient to stop the reflux of acid from the stomach into the esophagus through most of the time, but when the patient swallows, the food passes down the esophagus, the beads open, allowing the food to pass into the stomach, and then close behind the stomach once again, preventing the reflux of acid.
Well, after the procedure, I mean, it's fabulous. You know, I haven't had indigestion at all. You know, going from really bad every day to zero. I mean, it's the first time that I was able to eat tomato soup. You know, just stupid things like that normally so acidic but now I can just eat whatever I like now. It's amazing, really.
The Linx operation is still in its relative infancy, but the data and results to date seem to be extremely encouraging. The vast majority of patients appear to achieve a really good symptomatic outcome. The side effects associated with the Nissen operation seem to occur much less frequently, and the operation appears to be safe.
Well, I'm feeling, you know, 100% in myself again. You know, I do a lot of outdoor activities and that sort of thing, and I'm always worried about make sure I've got my pills with me and the Gaviscon and things like that. And now I don't have to worry about any of that anymore. I can just go out and do what I want to do, really.